Send someone to call EMS 911 and get an AED. If the baby is not breathing normally, start chest compressions immediately. Push hard, push fast. When you finish 30 compressions, give the baby 2 breaths. Each breath should have just enough air to make the chest begin to rise. Repeat the cycle of 30 compressions and 2 breaths. When the AED arrives, turn it on and follow the prompts. When the AED prompts you to give a shock, make sure everyone is clear of the baby and say aloud, "I'm clear, you're clear, everybody's clear." Then press the button to deliver the shock. Continue following the AED's prompts until more advanced care takes over.